Hey guys, it's Phil here. Today we're going to be discussing heel pain. So, what is heel pain? Heel pain is a really common condition we see here at podiatrists. It's a condition that commonly results from inflammation or injury to the structures in our heels and our feet. Uh, Common ones are the plantar fascia and the Achilles tendon, as you can see on this photo here, around right where I'm circling. So, common symptoms would include sharp or dull aches, and often at the back of the heel or underneath our feet. And especially this can occur either straight first thing in the mornings after waking from the bed, or a rest between activities. So common causes of heel pain. The most common thing we see here at the clinic is overuse injuries. So especially when someone's gone from little or no activity to kind of some intense activities, we see a lot of strain and physical pressure being placed on the heel. Another one is injury. Injuries such as sudden trauma or fall from a high place can cause high impact and cause heel pain, some bruising sometimes, and inflammation to the plantar fascia. Also, some underlying conditions such as plantar fasciitis, Achilles tendonitis, or arthritis can contribute to heel pain. So, some common heel pain conditions we see here at the clinic. Plantar fasciitis is probably the most common heel pain condition we see, and that's inflammation of a thick band of tissue of the plantar fascia that runs along the bottom of our feet and that connects our heel bone to the toes. This can cause pain and stiffness in the heel, and especially with the first steps in the morning. So if you think of an elastic band that runs from the bottom of our feet to the toes, this can be really tight and can feel sharp. Some stress fractures can occur in the heel, small cracks in the heel bone that occur due to repetitive stress or a high impact activity such as a jump and falling on our heels. And here you can see in the photo we've got Achilles tendonitis. This is pain and irritation of the Achilles tendon, so the tendon that connects our calf muscles to our heel bone. This can cause pain and stiffness and swelling in the back of our heel and ankle and lower leg. Often this can be debilitating if it's a serious condition. Some symptoms of heel pain. So, common symptoms we see: sharp and stabbing pains. So this will especially happen right first thing in the mornings and after rest. Sometimes the area will be puffy or swollen and tender to touch. In serious cases, it can cause difficulty walking. So when we change the way we walk because of our pain, we compensate, and as a result, we'll favour one side or favour a certain group of muscles, and this can lead to further injury. So diagnosing heel pain. Commonly, the podiatrist will conduct a physical examination and a biomechanical assessment. This involves joint and muscle testing, analysing your gait, and evaluating your mechanics of your feet and ankles. Some imaging, if required, if necessary, we can send off for X-rays, MRIs, and ultrasounds. This will be needed if we don't respond to conservative treatments. This will be to obtain a more detailed view of the structures in your heel and to identify anything untowards. Some treatments for heel pain. So, conservative therapies that will include the RICE protocol, which stands for Rest, Ice, Compress, and Elevate. And most of the time, we will prescribe you some stretching and strengthening exercises. And if need be, with some mechanics to help your foot posture, we can give you some orthotics. A common soft tissue therapy we provide here at the clinic is shockwave therapy, and that stands for extracorporeal shockwave therapy. We use high energy sound waves and pressurized air to stimulate healing and reduce pain. And these last two are more a rarity, but we includes injection therapy. So if need be, we can inject a cortisone or PRP therapy to the area if conservative treatments don't work. And in very rare cases, surgical intervention. So if conservative treatments and injection therapy don't work, we can go to surgical intervention. So surgical interventions like a plantar fascial release or a heel spur removal will address the underlying causes of your heel pain. Last thing, preventing heel pain. So proper footwear, something with a steel heel counter and a cushioning underneath the midsole and the heel with some good arch support will reduce and distribute your weight evenly. That will reduce the stress on your heel. Regular stretching, so calf stretches, plantar fascial stretches, will maintain flexibility and prevent tightness in those soft tissue structures. Last thing, weight management. So maintaining a healthy weight to reduce the amount of pressure and strain on our heels. This will lead to less forces put through the joints and our muscles, and that will lead to hopefully less pain. So takeaways. Heel pain is one of the most common conditions we treat here at the clinic, and it can be caused by a variety of factors, which is overuse, acute injuries, or any underlying medical conditions. A podiatrist can effectively diagnose your heel pain, and we can come up with a treatment plan according to your needs. So if you're experiencing any heel pain, give us a call or book online today. Thanks, guys.